Hi, I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. If that type of information interests you, please feel free to click the subscribe button. Don't forget to click the bell for immediate notifications when we upload new videos every week with brand new content. So let's get right to our next FAQ for you. Today we want to talk about what is M.E.A.T. M.E.A.T is really applied to HCC coding and risk adjustment guidelines. So M.E.A.T is applied to the logic to ensure the HCC coding accuracy of the documentation. So M.E.A.T stands for monitor, evaluate, assess or address, and treat. With monitoring, you're pretty much the provider is pretty much documenting the signs and symptoms, as well as disease progress or disease regression. With evaluate, you would be looking for documentation that supports test results, medication effectiveness, and responses to treatment. With the assess or address, you would look for documentation of tests that are being ordered, discussion or review of records, and counseling that may have been performed with the patient. And then lastly, you have treat. And so you're looking for medications, therapies, and other modalities to treat the patient. So all providers are required to document all conditions evaluated during the face-to-face encounter. And every diagnosis reported must be documented with an assessment and plan of care. So the M.E.A.T concept allows the provider to document specifically to the diagnoses that were assessed. Here are some of the top 5 fails in documentation. Number 1, failing to capture HCCs at least once every 12 months. Number 2, failing to ensure the diagnosis codes billed match the documentation in the medical record. Number 3, failing to document according to the M.E.A.T principles. Remember, the diagnosis needs to be monitored, evaluated, assessed or addressed, and treated. Number 4, failing to add any diagnosed HCCs to both the chronic problem list and the acute assessment. And number 5, failing to evaluate each of the HCCs on a semi-annual basis for updates. So there you have it, just a little bit of information regarding the M.E.A.T as it pertains to HCC coding. Hopefully this was helpful for you, particularly if you are involved in risk assessment coding and HCC. And if you have some thoughts or some additional things that you can add, please feel free to add them in the comment section below. I would love to hear your thoughts. Also, if this was valuable for you, please like the video and share the video. And if you haven't clicked on the subscribe button, what are you waiting for? Click on that button and join our community. So stay tuned to our next video where we will discuss some additional items that will prepare you to become a certified marketable medical coder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder, reminding you to be safe, be kind, and don't wish for it, work for it. Until next time, take care. Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder.